Ankylosing spondylitis. Ankylosing spondylitis is a type of arthritis that causes inflammation in the joints and ligaments of the spine. This lifelong condition, also known as Bechterew disease, usually starts in your lower back. It can spread up to your neck or damage joints in other parts of your body. Ankylosis means fused bones or other hard tissue. Spondylitis means inflammation in your spinal bones, or vertebrae. Severe cases can leave your spine hunched. Normally, the joints and ligaments in the spine help us move and bend. If you have ankylosing spondylitis, over time, the inflammation in the joints and tissues of the spine can cause stiffness. In severe cases, this may cause the vertebrae, bones in the spine, to fuse, grow together. When the vertebrae fuse, it can lead to a rigid and inflexible spine. Many people with ankylosing spondylitis have mild episodes of back pain and stiffness that come and go. But others have severe, ongoing pain with loss of flexibility in the spine. In addition, other symptoms may develop if other areas of the body, such as the hips, ribs, shoulders, knees, ankles, and feet, are affected by the disease. There is no cure for ankylosing spondylitis. Doctors recommend treatments that may include exercise and medications. They help to manage pain, control inflammation, improve posture and body position, and slow the progression of the disease. With treatment, most people with ankylosing spondylitis can have productive lives. Who gets ankylosing spondylitis? Anyone can get ankylosing spondylitis, however, certain factors may increase your risk for developing the disease. These factors include 1. Family history and genetics. If you have a family history of ankylosing spondylitis, you are more likely to develop the disease. 2. Age. Most people develop symptoms of ankylosing spondylitis before age 45. However, some people develop the disease when they are children or teens. 3. Sex. Men are more likely to have ankylosing spondylitis than women. 4. Other conditions. People who have Crohn's disease, ulcerative colitis, or psoriasis may be more likely to develop the disease. How common is ankylosing spondylitis? Ankylosing spondylitis belongs to a group of diseases known as spondyloarthropathies. Between 3 and 13 out of 1,000 Americans have one of these diseases. Symptoms of ankylosing spondylitis. The most common symptom of ankylosing spondylitis is lower back and or hip pain and stiffness. Over time, the symptoms may progress to other areas of the spine. The pain typically worsens during periods of rest or inactivity, which may cause some people to experience more pain during the middle of the night or after prolonged sitting. Usually, moving and exercise can help improve pain. Symptoms of ankylosing spondylitis. Symptoms of ankylosing spondylitis vary from person to person. Some people have mild episodes of pain that come and go, while others will have chronic, severe pain. The symptoms of ankylosing spondylitis, whether mild or severe, may worsen in flares and improve during periods of remission. Because the disease can affect other areas of the body, other symptoms may develop and may include pain, stiffness, and inflammation in other joints, such as the ribs, shoulders, knees, or feet. Difficulty taking deep breaths if the joints connecting the ribs are affected. Vision changes and eye pain due to uveitis, which is inflammation of the eye. Fatigue, or feeling very tired. Loss of appetite and weight loss. Skin rashes. Abdominal pain and loose bowel movements. Causes of ankylosing spondylitis. Researchers do not know the cause of ankylosing spondylitis. However, studies show that both genes and environment may lead to the development of the disease. Researchers know that the HLA-B27 gene increases the risk of developing ankylosing spondylitis, but this does not mean you will get the disease if you have the gene. Many people have the gene and never develop ankylosing spondylitis, which tells researchers that environmental factors also play a role. Researchers continue to discover many other gene variations that may cause the disease. However, HLA-B27 is the primary gene that increases your risk for developing ankylosing spondylitis. Conditions related to ankylosing spondylitis. Ankylosing spondylitis is a type of spondyloarthritis. This is the name for a group of conditions with similar symptoms, mainly pain and stiffness around the spine. Here are some other types of spondyloarthritis. Non-radiographic axial spondyloarthritis. The main symptoms are similar to ankylosing spondylitis, pain and stiffness around the spine. But there won't be physical changes to the back that can be seen on an X-ray. Some people with this condition are later diagnosed with ankylosing spondylitis. Psoriatic spondyloarthritis is a form of psoriatic arthritis that can occur alongside the skin condition psoriasis. People with psoriasis can get red, scaly patches of skin. Spondyloarthritis associated with inflammatory bowel disease, which is also called enteropathic arthritis. This is related to bowel conditions such as Crohn's disease or ulcerative colitis. The bowel is part of the digestive system that helps to break down the food we eat. Reactive arthritis. Reactive arthritis is diagnosed when your arthritis is a reaction to an infection. Enthesitis-related juvenile idiopathic arthritis. It is the name used when children and teenagers develop inflammation in entheses, the sites where tendons and ligaments attach to bones. How is ankylosing spondylitis, AS, diagnosed? There isn't a test that definitively diagnoses ankylosing spondylitis. After reviewing your symptoms and family history, your doctor will perform a physical exam. Your doctor may order one or more of these tests to help guide diagnosis. Imaging scans. Magnetic resonance imaging, MRI, scans can detect spine problems earlier than traditional X-rays. Still, your doctor may order spine X-rays to check for arthritis or rule out other problems. Blood tests. Blood tests can check for the presence of the HLA-B27 gene. About 8% of people of European descent have this gene, but only a quarter of them develop ankylosing spondylitis. What are the complications of ankylosing spondylitis, AS? Ankylosing spondylitis may affect more than the spine. The disease may inflame joints in the pelvis, shoulders, hips and knees, and between the spine and ribs. People with AS are more prone to spinal fractures, broken vertebrae. Other complications include fused vertebrae, ankylosis, kyphosis, forward curvature of the spine, osteoporosis, painful eye inflammation, iritis or uveitis, and sensitivity to light, photophobia. Heart disease, including aortitis, arrhythmia and cardiomyopathy. Chest pain that affects breathing. Jaw inflammation. Cauda-equina syndrome, nerve scarring and inflammation. Ankylosing spondylitis treatments. Medications help some people, but staying active is one of the keys to managing AS. Exercise. The less you sit or lie down, the better you'll feel. Exercise helps you stand straighter and keeps your spine limber. Staying active may even banish your pain without medication. Physical therapy. You'll need to practice good posture, learn how to stretch tight muscles and keep your spine stable, and use other techniques that can lower your pain. You can do them at home, but most people benefit more from working with a professional physical therapist or with a group. Medication for ankylosing spondylitis. Prescription non-steroidal anti-inflammatory drugs, NSAIDs, like indomethacin, Indocin, help most people who have AS. But they can lead to stomach bleeding, heart problems, and other side effects. If your condition is severe, your doctor may have you try stronger medications like biologics. These are made with things like proteins, but they may cause serious side effects, including infections. Disease-modifying anti-rheumatic drugs, DMARDs. Drugs such as sulfasalazine and methotrexate can treat arthritis in your arms and legs, although they're not usually effective for spinal symptoms. These drugs, called disease-modifying anti-rheumatic drugs, DMARDs, can reduce the amount of inflammation that happens in your body. This means that as well as treating symptoms, they can help prevent joint damage. These drugs can sometimes take several weeks or months to take effect. When they do take effect, they can make a big difference to your pain and stiffness. They're often long-term treatments. When taking DMARDs, you'll need regular checkups and blood tests to monitor their effect. Biological therapies. Biological therapies are newer treatments that can be very effective for some people with ankylosing spondylitis and related conditions. These drugs have a more targeted approach to stop inflammation than the older MARDs. They aren't suitable for everyone and can only be prescribed if your condition can't be controlled with anti-inflammatory drugs and physiotherapy. There are a group of biological therapies called anti-TNF drugs. The following can treat ankylosing spondylitis: etanercept, adalimumab, certolizumab pegol, golimumab. Secukinumab is a different type of biological therapy that can also treat ankylosing spondylitis. It's one of a new family of biological therapies called interleukin, or IL-17 inhibitors. This drug also works by reducing or slowing inflammation. These drugs are given as an injection, which you, or a partner, relative or friend can learn to do. The effect of biological therapies will be monitored, and you'll need to complete questionnaires regularly to check how well you are responding to treatment. Steroids for treating AS. Steroids can be used as a short-term treatment for flare-ups. They're usually given as an injection into a swollen joint or as a slow-release injection into a muscle. They can also treat painful tendons, for example at the heel, although they aren't repeated too often as they can cause tendon weakness. Occasionally, you may be given a course of steroid tablets called prednisolone. While these treatments can be very effective at improving pain and stiffness, you may develop side effects if you use them for long periods. If you've been prescribed steroid tablets, talk to your doctor about the risk of side effects and how you might be able to reduce your chances of getting them. As with any drug, report any side effects to your doctor immediately. Eye inflammation. If you develop eye inflammation, it will usually be treated with steroid eye drops. In more severe cases of eye inflammation, steroids may be given as tablets or as an injection into the eye. Physical therapies for AS. Physiotherapy is a very important part of the treatment for ankylosing spondylitis. A physiotherapist can put together a program of exercises to improve your muscle strength and help you maintain mobility in your spine and other joints. It's especially important to exercise your back and neck to avoid them stiffening into a bent position. A physiotherapist will advise you on how to maintain good posture and may be able to offer you hydrotherapy, also known as aquatic therapy. This involves specific exercises for the spine, hips and shoulders carried out in a special warm water pool. Many people with ankylosing spondylitis find this therapy helpful and continue their program at their local swimming pool. Surgery for treating AS. Most people with ankylosing spondylitis don't need surgery, although some people may need a hip or knee replacement if these joints are badly affected. This can get rid of pain and improve mobility. If you're concerned about your spine being bent, raise this with your rheumatologist. Any decision about surgery is difficult and should also involve an experienced spinal surgeon. Though it's very rare for people to need surgery on their back because of ankylosing spondylitis, it can dramatically improve some people's lives. Ankylosing spondylitis lifestyle and home remedies. Some things you do every day can help you feel better. Make time to exercise every day, even a few minutes at a time. Working out in water helps a lot of people who have AS. Keep a healthy weight so your joints aren't under as much stress. A diet high in omega-3 fatty acids might help. Watch for patterns if you think certain foods might trigger changes in how you feel. Don't smoke. People who smoke tobacco often have symptoms that get worse as they get older. Manage stress with things like massage, yoga, meditation, and counseling. Apply heat to stiff joints and tight muscles, and use cold on inflamed areas. Living with ankylosing spondylitis. Medical treatments can help control ankylosing spondylitis. And there are also many things you can do to help improve your symptoms. Keeping active and paying attention to your posture can greatly help you minimize the long-term effects of this condition. Sex, pregnancy and ankylosing spondylitis. Sex may be painful if you have ankylosing spondylitis. If it is, try taking some painkillers beforehand and experiment with different positions. Ankylosing spondylitis and sex life. Ankylosing spondylitis can make you feel tired, so it's important your partner understands how your condition affects you. Good communication can help you maintain an active sex life, and counseling can sometimes benefit both partners. It's fine to use the contraceptive pill if you have ankylosing spondylitis, but you should tell your doctor you're taking it. If you're thinking of starting a family, it's very important for both men and women with ankylosing spondylitis to discuss medication with a doctor beforehand. Some drugs such as methotrexate should be stopped several months before a woman tries to get pregnant. Latest research suggests it's safe for men to take methotrexate when trying for a baby with their partner. Biological therapies seem to be safe in the earlier stages of pregnancy but are then stopped later in pregnancy. If you become pregnant while using a conventional MARD such as methotrexate or a biological therapy, discuss this with your rheumatology team as soon as possible. Usually, pregnancy doesn't cause any special problems for the mother or baby, though the symptoms of ankylosing spondylitis may not ease during pregnancy. If your spine is very stiff, it may not be possible to have an epidural during childbirth. This is an injection into the back that stops people feeling pain in part of the body. If your condition makes it difficult to open your legs, it's a good idea to think ahead about the delivery. Discuss with the medical team at your antenatal appointments whether a cesarean section might be better. This is an operation to deliver a baby through a cut made in a woman's tummy and womb. Will my children develop ankylosing spondylitis? If you have ankylosing spondylitis, there's a small chance your children will also develop it. The way it runs in families isn't straightforward, so if you're thinking of having a baby and are concerned about this, it's a good idea to talk to your specialist. Parents with ankylosing spondylitis sometimes ask if their children should have the HLA-B27 test to see whether they might develop the condition in the future. This isn't recommended because there's no way of knowing whether a child will develop ankylosing spondylitis even if they do have the gene. Feet and footwear. People with ankylosing spondylitis may develop plantar fasciitis, a condition that causes pain in the heel or arch of the foot. If your feet are affected, you may benefit from custom-made insoles inside your shoes. These can also be called orthotics. Such insoles may help keep your lower limbs in the correct position, and relieve pain in your hips, pelvis or lower back. A podiatrist is a trained foot specialist, who can assess and advise whether you need custom-made insoles. Sorbothane insoles or gel heel cushions can provide padding and may be enough to ease your discomfort. These can be found in your local chemist or sports shop. Driving with ankylosing spondylitis. Driving shouldn't be a problem if you have ankylosing spondylitis, but there are a few points to bear in mind. On a long journey, stop from time to time at a safe place for 5 minutes and get out of the car for a stretch and quick walk around. If your neck or back is very stiff, reversing into parking spaces may be more difficult. Special mirrors and parking sensors can be fitted to help with this. You should inform the Driver and Vehicle Licensing Agency, DVLA, of your condition if you use fitted adaptations. If your neck is stiff, it will be more prone to injury. Make sure your headrest is correctly adjusted and that you keep your head back against it. Diet and nutrition. No particular foods have been found to make ankylosing spondylitis either better or worse. However, eating a low-fat, healthy and balanced diet will help you stay a healthy weight for you and is also good for your heart and general health. Being overweight will increase the strain on your back and other joints. Ankylosing spondylitis can increase your risk of the condition osteoporosis. It makes bones thinner and it's important that you get enough calcium and vitamin D to keep your bones healthy. The best source of vitamin D is from sunshine on the skin. However, because we can't guarantee sunshine all year round in some countries, it's recommended we should all take vitamin D supplements daily in the autumn and winter months. People at risk of not getting enough vitamin D from the sunshine are encouraged to take vitamin D supplements all year round. This includes people who don't spend much time outdoors, wear clothes that cover all their skin, have dark skin, as darker skin is not as good at absorbing vitamin D from sunshine. Calcium is very important to make strong bones. The best forms of calcium are dairy products such as milk, cheese and yogurt. Low-fat ones are best. Calcium-enriched milks made from soya, rice or oats. Fish that are eaten with the bones, such as tin sardines. Many diets have been recommended for people with ankylosing spondylitis, including avoiding certain food types. There's no convincing evidence that these work, and there's a chance you could miss out on essential nutrients. If you're keen to try any of these diets, it would be a good idea to discuss it with a dietitian or your doctor first.